Hey guys, it's John Adamson with Seeking Light, and we're going to be doing session 7 of Applied Ethics Medical Mandates. I'm sorry, but the camera, it's decided it's not going to work, and I'm not sure why, but it's just the way my computer is. But you're saved having to look at my face. This will be a little bit longer session. Also, again, my main focus on this is getting your feedback, and so I do appreciate that. So today's focus is going to be on other considerations related to ethics of mandates. Because besides the ethical principles that we've talked about already, we do need to talk about some additional ethical principles. But first, we're going to do a recap. So just remember, everybody in the world has a worldview, a lens through which they judge the world on the basis of what is right and what is wrong. Again, there's no such thing as personal truth. We all experience truth in different ways. We have different perspectives on truth, but truth is truth. It is objectively discerned. There is one thing, though, in ethics, and that is generally all systems of belief, all worldviews can have overlap. And so it's important for us to discover what that overlap is and then discuss the ethical principles that should guide society from that overlap. People have used the golden rule to justify vaccine mandates, but this is far too simplistic to just only say get the vaccine because you're going to kill grandma. We looked at the principles of beneficence and non-maleficence and how you really do need to make sure that when you're stating something needs to be done, you are saying that beneficence does indeed outweigh the potential harm or maleficence. And there's lots of different types of harm, not just physical, that need to be addressed. Also, justice does play into this. There are people in power who have authority who don't always have our justice in mind when they mandate things. It's important that veracity or truthfulness is looked at. And we have seen that there is a lot of competing truth claims, but unfortunately, some of the things that have been brought up about concerns related to medical mandates have been largely snuffed out by the media. We talked about confidentiality, the fact that there's no way, if you're going to distinguish people societally by making certain groups get tested, wear certain kinds of masks, etc., that you're going to hide the fact that they are unvaccinated and you are setting up a society that is not recognizing confidentiality. Autonomy. This is one of the age-old principles of ethics. It has been found to be a true application of ethics in law, that people have a right to say what shall or shall not be done to their bodies. And finally, there is an American ethic, e pluribus unum, from the many one, which has implications related to the fact that a group of many should not be imposing the will upon a smaller group or one. Now, I decided to bring up some definitions to consider. So a patient, what is a patient? It's an individual who is awaiting or under medical care and treatment. This is a Merriam-Webster dictionary definition. So keep that in mind. A patient is an individual. Doesn't matter what setting this person is in, whether it's work, home, just on their free time, whatever it is, a person is considered a patient if they are under medical care or they're receiving medical treatment. Now, vaccine is defined, and this is according to the NIH, the National Institutes of Health, as a minor medical procedure that reduces or eliminates the risk of contracting a targeted disease. And since these shots have been called a vaccine, therefore, is a medical procedure, and therefore, anyone receiving the vaccine is a patient. And with that said, if they're a patient, they have what are called patient rights. Another definition we must look at is informed consent. This is the American Medical Association, what they have to say about informed consent. Informed consent to medical treatment is fundamental in both ethics and law. So remember, ethics does not equal law or vice versa, although they have overlap. Patients have the right to receive information and ask questions about recommended treatments so that they can make well-considered decisions about care. Successful communication in the patient-physician relationship fosters trust and supports shared decision making. Now, you can substitute that word physician for any healthcare provider that's about to give somebody something, such as a shot. So let's look at the first part of that definition. Patients have the right. So what is a right? It's something that is guaranteed. You are entitled to rights. It is right to have rights. In other words, it's ethical. And notice what this definition says. Fundamental rights, which would include things like informed consent. A government may not interfere with these things. I put together this schematic to discuss this point. So we have a right to receive information and question. So whenever you have somebody presenting information as fact, there should be the opportunity to oppose those facts or question those facts. So we should all have access to experts who are taking one position and experts who are taking another position. Unfortunately, what we've largely seen in mainstream media is the use of an expert on one side without somebody presenting the case on the other. So anyway, you have these experts. They're arguing with facts and obviously their opinion. And then you, the competent patient, which we're going to talk about more in a minute, are listening to what these facts and opinions are coming from both experts or both sides, or there might be more than two sides. Now, you may have within you fear of the information that's being provided by one or dislike of a certain expert. And of course, you're going to have your preconceptions, you're going to have your politics, and let's face it, in this particular area that we're talking about, which is vaccine or medical mandates like wearing masks, there has been a very political sidedness to the discussion. So anyway, the competent patient takes in this information, and if it's provided fairly, if veracity has been utilized, truthfulness on both sides, that competent patient can now weigh out the differences between what the experts are saying and come up with a decision or action. One of the things that I think is vitally important is a recognition that people who are truly expert in something should be able to tell you what they know in such a way that you can then understand it. I love this quote by Albert Einstein. If you can't explain it simply, you don't understand it well enough. And what we're seeing is a lot of obfuscation. What does that mean? Just confusing language around the whole discussion of medical mandates. And it's pretty clear when you listen to some of these pundits on either side of the aisle, they sound like they are smart, they're erudite, but they don't clearly understand what they're talking about because they confuse the situation by using a lot of highfalutin terminology. I like to call it word salad. I'm not the originator of that phrase, where they're just trying to explain something, but it's clear they don't have a real good grasp on it. A true expert is going to be able to tell you in clear, concise language what something means, so then you can take their expert knowledge and use your common sense, if you will, to apply it to making a decision. Now, going back to the AMA's definition, one of the things they say is that a patient has a right to shared decision making. So you have the doctor who informs the patient, and then if the patient says, yes, doctor, you may do this, that, or the other thing, or Yes, healthcare provider, you may do this, that, or the other thing. You then have informed consent, that is shared decision making, and the AMA recognizes that. Now, going back to what the AMA has to say about informed consent, informed consent involves providing patients with accurate, so going back to that ethical principle of veracity, and adequate information about the risks. So risks, that would fall under maleficence, the potential to do evil with an intervention. Benefits, so the opportunity to do good with that intervention. And alternatives. We've talked a little bit about the fact that there are alternatives to vaccines, and these are well researched and have been out there for a while. They've just been suppressed. So the doctor has a responsibility to enlighten their patient about risks, benefits, and alternatives of a treatment in a manner that is free from coercion. So let's talk about coercion from a legal perspective. The broad definition of coercion is the use of express or implied threats of violence or reprisal, such as discharge from employment, or other intimidating behavior that puts a person in immediate fear of the consequences in order to compel that person to act against his or her will. So here's an example of coercion, and this is actually an NBC interview done with Dr. Anthony Fauci, who said the following. And so I synopsized briefly what he said right before this. There are those who just do not want to comply and get vaccinated. We've got to get them vaccinated, and hopefully they will do it willingly. If not, there will have to be things that will essentially put pressure on them, such as you're not going to work in this particular agency or institution. You're not going to be able to go to this college or this university unless, in fact, you get vaccinated. That, my friends, is what is called coercion, fear of reprisal if you don't do something. Now let's talk further about the AMA's guidance of informed consent, which again is an ethical principle of healthcare. The process of informed consent occurs when communication between a patient and physician results in the patient's authorization or agreement to undergo a specific medical intervention. In seeking a patient's informed consent, physicians should, 1, assess the patient's ability to understand relevant medical information and the implications of treatment alternatives to make an independent, voluntary, read non-coerced decision. And so this goes back to the ethical principle of making sure they know the risks, benefits, and alternatives to treatment. Number 2, present relevant information accurately and sensitively in keeping with the patient's preferences for receiving medical information. The physician should include information about, again, the burdens, the risks, and the expected benefits of all options, including foregoing treatment. Now, informed consent is required when you're dealing with a competent patient. Now, how do you determine that? Well, the Mental Capacity Act of 2005 defines a competent patient as one who is able to take a decision for himself, can understand and retain the information, weigh that information, and communicate their decision. And the AMA also gives some guidance on how to assess somebody's decision-making capability. Can they demonstrate the ability to understand it? Can they demonstrate the ability to appreciate how that information applies to their situation? Can they reason with that information? And can they demonstrate the ability to make a choice and express it? One of the ways you can determine whether somebody understands the information you provided them is if they can then articulate and talk back to you the risks, benefits, and alternatives to the treatment that you've offered and the ramifications of each. So here are some examples that I just whipped up that would show or demonstrate understanding. So you're telling me that the magic fairy dust, you can assume what belongs there, reduces my risk of severe illness, hospitalization, and death. That means that if I don't take the magic fairy dust, I'm more likely to experience severe illness, end up in the hospital, and die. Here's another statement, and this would be from an employer. Even though my employees are not vaccinated, they have been educated in the risks, benefits of vaccinations and have agreed to work with each other. And we have taken precautions to prevent infections with customers, including alerting them that we have non-vaccinated employees. So this would then help fulfill some of the disclosure or to get informed consent, in this case of a customer coming into a business. Here's some other examples. I'm deciding to not take the magic fairy dust. I understand by not taking it, I place myself at a greater risk for illness, hospitalization, and death. I make this decision willingly and without coercion. Here's another statement. I understand that the potential risk of spread may be higher since I did not take the magic fairy dust. Now there is some contention about that. Therefore, I should take the following precautions when around other people to not spread the disease. So let's recap. With the AMA's full blessing, ethically, a person receiving a vaccine is a patient. It doesn't matter what setting you're in, whether you're going to work, whether you're staying home, whether you're going to concerts or out to eat, or walking down the street in a city. Somebody that's being told they must receive a vaccine becomes a patient. A patient has a right to have the risks and benefits, and I should have put alternatives there, of the vaccine explained to him or her. If the patient demonstrates competence in understanding the risks, benefits, or alternatives of the vaccination and decides against it, that is his, her right ethically. Well, folks, that's all I've got for this session, and we're just about done with this course. I will be doing kind of a summary recap, but again, I want your comments. I covet your comments. I want you to tell me what you think. If you've followed this all the way through, your comments are very valuable to me. Some of you have made comments that have been very helpful in some earlier slides, but I definitely want those comments, and your support is certainly welcome. And I am at Venmo. There's my Venmo address. It would be helpful if you can throw a few bucks to me if you are benefited at all by my videos. If they're valuable to you, then, show me some love. I do appreciate it. This is a passion. I will do it regardless, but it does help. Anyway, John Adamson with Seeking Light. Thank you so much for watching. Take care and God bless.